Good afternoon. This is Dr. Lewerenz at Longevity Health Institute. Hope this is finding you well. I'm here in my Rochester office and hope you are doing well, and this is somewhat insightful and can educate you a bit. My whole intent. So, as most of you know, I practice integrative functional medicine. We look at you as a whole. And I had the unfortunate bit to earlier this week, to have to go down to Texas and sit for my oral part of my recertification for my family practice boards. And something came to mind when I was doing my recertification exam, which is a lot of fun because they just drill you with questions and have you treat a patient like you're back in med school, and something I did 25 years ago. So a lot of interesting, fun stuff. But the thing that I picked up on and thought I'd share with you is that we treat here tons and tons and tons of digestive issues and help a lot of patients, hundreds of patients a year, solve and fix and re-regulate their digestive health and their gut health and stuff, whether it's irritable bowel, or they have Crohn's, or they have celiac, or they have a food allergy sensitivity, or they have heartburn or reflux or esophagitis or Barrett's esophagus, or I can go on and on. And we get down to the root functionality of the issue to get cellular healing and to treat the gut imbalance or the gut overgrowth, or to get them to absorb their nutrients more appropriately. And in a simplistic way of making it sound, we heal the wound. Wherever the wound is, just as if you had a wound on your skin, we use things that are naturally, supplementally appropriate to get wound healing, to get epithelial cell and tissue healing, mucosal healing at the gut and digestive lining. But one thing I thought I'd share with you that is underappreciated, and we often refer patients out to great practitioners for this, is the structural stuff when somebody has irritable bowel syndrome or digestive symptoms. So again, we treat the whole person here. We treat you very individualized. We look at all the systems. We consider genetics, hormones, diet and gut health, how you detoxify and toxins in your body, stress and mind-body effects, and structural things. And one thing that's very interesting structurally is that there's a feedback loop structurally with your autonomic nervous system, essentially in your brain and spine, and nervous system going out to organs like gut, colon, esophagus, and that if you treat the patient's sympathetic system and autonomic system and parasympathetic system, you can now regulate or help regulate this balance and this delicate thing that we have in our body that creates this symbiotic relationship, and have better gut health. And with, let's just say, an irritable bowel syndrome, often we can even help somebody regulate their bowels by having somebody see a practitioner that does neck adjustments in their occipital olanal area or on their sacral area, because this helps parasympathetic tone. It resets the vagus nerve. It helps the regularity of the bowel function, okay? And you can even do things on the spinal column with the spinal column and the ribs that help set the autonomic function, so they're not getting so much external stimulation to the gut and to the bowel that are creating this imbalance in the structure and having irritability, whether it's constipation, diarrhea, cramps, bloating, this kind of thing. Sometimes even simplistic things we direct people to are getting massages, medical massages, deep tissue massages, lymphatic things, effleurage, things that help tissue movement and tissue flow in creating that structural full balance. Okay, so we treat you again as a whole. We look at the whole person. It's always the most important thing in here at Longevity Health Institute in our personalized approach. And I wanted to share that part with you because, yes, when you treat somebody very individualized with purpose and intent, you can get an excellent result, and you have to consider the whole person. So I hope this finds you well, and always consider things like soft tissue treatments, massage therapies, acupuncture, structural things. I'm innately a DO, a doctor of osteopathy, so I do some adjustments and some hands-on work with a patient's spine and neck and stuff, but I often, because of expertise, I'll even refer that out. But the importance is to address it and not ignore it, because we're a whole. So this is Dr. Lewerenz. Be well, and I hope you have a wonderful day.